like to turn then the floor to Tilly Metz to reflect, if you wish, the Dementia Yearbook and a couple of other points what you have been listening. And while we are a bit late, I would transfer the closing remarks as well to you. I've had my share of being allowed and posing the questions, so please, you will continue. And on my behalf, thank you for all the speakers, participants, and Alzheimer Europe office for all the preparations.
Thank you very much, Sirpa, and also that you have been there and moderating and all the work you have done, and also to all the experts presenting their work. And so thank you very much. Unfortunately, because I was in speaking the Environment and Public Health and Food Safety Committee, I could not be there from the beginning on, but now I'm very happy to be among you. I was following since some time, and my office, of course, was following the whole workshop and also sent me some notes on that. So I was reading in parallel and listening now in parallel. So first of all, thank you again for the excellent insights that we got here. And there are currently around 8 million people living with dementia in the European Union, and this number is even expected to reach 14 million by 2050. There has been much focus on programs such as EU for Health and Horizon Europe research programs, and they are both essential in order to provide investment in health and research system while ensuring transparency and conditionalities when publicly funded. So my office has followed with great interest with presentation of the European care strategy as presented by Mrs. Stendler. Social care services need to enable persons with support in order to live independently, to be active, and to have a chance to participate and decide upon their own life without discrimination. So care services need to support their full participation in the society on an equal eye level with others, and also not putting them at the borders of the society. Also, when you have brain and mental issues, this is very important. So an inclusive society should recognize their needs and also, on the other hand, accept their difference. However, social care is in a crisis due to underfunding, staff shortages, and maybe also an over-reliance on EU mobile and migrant care workers who often then have also very difficult working conditions. And as you might know, I'm one of the vice presidents of the European Disability Intergroup, and so this is really a cause close to my heart, and I totally advocate for the European strategy on the rights of persons with disability that was presented by Alejandro. He presented the convention, but also spoke about the European strategy in order to implement really this convention on the rights of persons with disability based on equality and non-discrimination, as I said already, as underlined by Alejandro. You might also know that I'm an opponent to the draft additional protocol of the Oviedo Convention, which aims at regulating involuntary treatment and placement in psychiatry. Involuntary placement in psychiatry can only be a very short-term emergency measure to protect the person or himself or to society. But forced treatment or forced sterilization, there's also a petition on this going around, is totally against the spirit of the UN Convention, which in its spirit protects the rights of persons with disability, including persons with, of course, psychosocial disabilities, people with intellectual disabilities, and people with dementia. And as a final word, I would like to stress how important it is also that we address stigma, isolation, and discrimination, especially with the COVID crisis, crisis that we are still in, even though I'm optimistic that it comes to an end. But we really had places and a lot of numbers even of scandals regarding their people with disability and with dementia, and regarding their lack of care at those moments. And we should really focus also on ensuring equitable access to treatment, services and support for all those who live with disabilities and dementia across Europe, and their families, who often also act as informal carers, a situation which also needs to be better addressed. So thank you again a lot for this workshop, and I really hope that the next time I can be following from the beginning on. That is really my aim, but I know that we were, as members of the European Parliament, very good represented by Sirpa. So thank you very much to all of you for your input, and I'm looking forward also, if there are, of course, I'm sure you're making notes of all that has been said, so looking forward also to get that. So thank you very much also for having me.